Can you hear that? Yeah. Oh. Hello everyone. Welcome again. My name is Jasha Lyons Echohawk, and I am the Census Community Builder for Oklahoma Policy Institute and Together Oklahoma. And if you're here in the anniversary of the Medicaid policy that was enacted back in 1965. It's the 55th anniversary. So I had our celebration music. Yes, happy 55th birthday, Medicaid. We here at Together Oklahoma and Oklahoma Policy Institute wanted to do a census event in connection to this anniversary date because the census data drives the federal dollars for Medicaid funding in our state. So, as you notice, I have a person right beside me. This is not somebody we've had before, but we wanted to definitely make our events inclusive. And so we have an ASL interpreter. So you'll see this person interpreting just like you would at a public event. So for those of you who are hearing impaired, I hope this is accessible for you. All right, so tonight we have a panel for you, as well as some videos. We're taking a virtual road trip through Oklahoma to talk about the impacts of Medicaid in a lot of our communities. Medicaid can be this kind of thing that you don't really know unless you've really been living with it. So we have this panel who is going to provide some context for life without Medicaid, life with Medicaid, legislative issues surrounding Medicaid, and then Oklahoma policies timeline for Medicaid expansion. So before I get started, I just want to say, grounding us in this current situation that we're in, we are bringing these virtual events with census outreach, due in part to the viral pandemic. We want to make sure everybody's safe. Everybody is able to view from a distance, but hopefully you're able to continue to not just take in the message, but share out the message. So we've been providing a giveaway with each of our events. We encourage you to comment, tell us where you're from, or anything you'd like to comment, preferably positive. And then also sharing this event. The more times you share and the more times you comment, you are entered into a drawing of one of three random gift cards that we'll give away and announce the winners at the very end of this program. We have a special treat, though, in honor of this very, very historic day. We are also going to send a mask made by one of our very own Oklahomans, Tracy Burrows Newcomen, and her partner, which I can't remember her name right now, but I'll announce that in a minute. Hi, Harriet from OKC. Good to have you. We'll include one of those homemade masks. They are very, very thorough in not just their craft, but also in ensuring that it is a mask that you can use. It has a filter inside. Wouldn't say it's medical grade, but it's pretty dang safe. So those winners will receive a gift card and a mask. So without further ado, I am going to move on to introducing our panelists to kick us off. We again, just to backtrack a little bit. The census count is going on right now. It's been going on since April 1st, and it definitely has been impacted by the viral pandemic. So there's been an extension of the count to October 31st of this year. That's still not a lot of time, given that our state, in terms of response rates, are still at a much lower rate than even what 2010 produced. And the number of households that were counted back in 2010 where 3 out of 4, or about 70% of Oklahomans, were counted. It matters in terms of funding when you think about the data that drives or directs the funding. Housing programs, education programs, uh, food programs, agriculture programs, education programs. I think I said that healthcare programs like Medicaid are dependent on this population data. And it's not just adults, it's not, it's everybody that was born on or before April 1st of 2020. So if you had an April Fool's Day baby, count them, please. If you have members in your home that you're not related to, please count them. There are a number of ways you can do the census, and we have the website scrolling down below at my2020census.gov. You can also call in. There have been packets mailed to you all, or there has been an enumerator to drop it off, and you can fill it out that way. Those are the safest ways you can fill out the census, and also the least sociable ways to fill out the census in terms of the enumerators that are going to come knocking on your doors for those of you who haven't filled out your census in the effort to count everybody. So if you're somebody who kind of likes your privacy, or you're very sheltered in place, or wanting to be away from anybody that doesn't live in your home, well, then get on your phones, get on your tablets, get on your computers, and fill out your census. The survey itself takes about 5 to 10 minutes. It's only 10 questions, and it's not anything that's super in depth. It just wants to know how many people in your home, what race, maybe what tribal affiliation, ages, and you fill it out and you send it off. Again, you can do it online, or you can do it by phone, or you can do it by the packet, return the packet, and it's paid postage, so you don't have to worry about stamps. Otherwise, you'll have an enumerator knocking on your door, coming to count you. And we would love for you to be counted that way as well. But I'm just saying, if you'd rather do it from the comfort of your bed, then please do so now. So with that, immigration status is not there's no citizenship question on the census. Regardless of your immigration status, everybody counts. So please count everybody. The census is confidential. There's federal law that prohibits the Census Bureau from sharing with any federal law enforcement, ICE, police departments. Nobody else can know your information. It's all with the Census Bureau personally, or your private information is protected. With all of that, I think I've explained enough. And let's go on to this panel. We have 3 panelists for us to kick us off and ground us in Medicaid and the connections to the census. We have Carly Putnam, Angela Munson, and Mike Dover. So I'll start with Senator Munson. She's a former senator from Oklahoma. She's been engaged in healthcare policy activities for more than 35 years. And until 2018, she was employed by the Oklahoma University Health Sciences Center as Associate Provost for Community Partnerships and Health, and also served as an adjunct associate professor in the Department of Family and Preventative Medicine. Her time in the Oklahoma State Senate was from 1993 until 2005, and in the Oklahoma House of Representatives from November 1990 until her election to the state Senate. So a very accomplished individual who also volunteers with Together Oklahoma. Next, we have Mr. Mike Dover, who retired in 2012 after a career dedicated to serving others. He is a native of St. Louis and has degrees in social work from the University of Missouri and St. Louis University. In 1980, Mike moved to Oklahoma to serve as an executive director of the Oklahoma chapter National Association of Social Workers, and joined the faculty in the OU School of Social Work. He later went on to serve 27 years as executive director of Variety Health Center, a community health center in Oklahoma City. Let's see. Yes, he also has a really accomplished background in health. He co-chaired the Healthy Babies Coalition, which is a statewide advocacy effort resulting in the Oklahoma Healthcare Authority's Soon to Be Sooner program, again, dependent on population data, dependent on census data. A Medicaid-funded initiative. The Soon to Be Sooner program is a Medicaid-funded initiative providing prenatal care for low-income women, regardless of immigration status. Upon his retirement, the OKC Council renamed Lafayette Park Mike Dover Park after a career dedicated to increasing health care for the uninsured and underinsured. Thank you all so much for being here. And finally, to my coworker, Carly Putnam. Some of y'all are very familiar with Carly. Carly joined Oklahoma Policy in January 2014. Carly moved from Kansas City to attend the University of Tulsa, where she graduated in 2013. As OK Policy's policy director and primary healthcare policy analyst, Carly supervises policy staff and oversees the organization's healthcare research. Additionally, Carly has been a part of the our organization's drive behind the 802 Medicaid expansion push and has coordinated with many of our volunteers and staff to get Medicaid expansion, not just written down and recorded, but getting people activated and engaged and understanding the complexity of Medicaid. So I appreciate you all for being here. Thank you so much. Yeah, I'm so honored. If everybody could unmute, we can get to talking. Um, so I invited these folks due to their yeah, to their wealth of knowledge that they can impart to all of you who are joining us tonight and making the connections to census promotion. I believe Mike and Angela have more of the historical part of life without Medicaid. And so if maybe we could speak to Mike first, because I think maybe he's older.
That's for sure.
Yeah. So, Mike, I mean, if you could go ahead and I don't know if I missed anything you want to highlight, and then just yeah, tell us what it was like pre-Medicaid, and then anything else you can impart about that.
Well, thank you, Jessica. I came to Variety Health Center in the early '80s. Variety was a little small nonprofit community health center whose mission is maternal and child health care for low income families. Our unique mission was based on the fact that we wanted to serve people who really didn't have any alternatives for care, i.e., they weren't even eligible for Medicaid because of their economic status or because of their immigration status. And so, shortly after I arrived at Variety, I overheard a conversation that was very, very, very awkward. I can still vividly remember a 10-year-old little boy who was translating for his mother at a family planning visit. And it was just so inappropriate and it was just so awkward. Shortly after that, I went and recruited actually a woman who was a secretary in the School of Social Work at OU to come and serve as a receptionist at Variety. And with that kind of hiring decision, again in the very early '80s, it's sort of like build it and they will come. Variety quickly became sort of the go-to clinic for women and children who in this case were Hispanic, who actually they were not on eligible for Medicaid, but their children were when they were born. They were, of course, little citizens. But when comments were made about the clinic and the word got out, what happened is that folks would call and they were actually the mothers or the children were on Medicaid, but the mothers would say they're not because they could actually come to Variety and actually have a folks there who could translate. And there were frankly many other places at that time who were able to do that. So over the years, Variety became kind of a place where um, 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 the Hispanic population felt safe and comfortable. Um,
Hey, Mike,
jump,
real quick,
yes,
can I ask you to speak up a little louder? Our interpreter is having a hard time hearing you.
I can. Of
Thank
course.
you.
Okay, I'll try to do that, of course. And
Thank
so,
you.
shortly after that, the Hispanic population kind of growth at our health center, and the times were such that again we became the kind of go-to place for women and children of course every ethnic group and race, but the growth was particularly large in the Hispanic community. And then came along in about 2007 the infamous House Bill 1804. For those of you who were around then, of course, Angela remembers that so well. And it was a bill that passed here in Oklahoma, and it was touted as, in both sides of the folks who were for it and against it, at no doubt as the toughest anti-immigration law in the country. But the reality was that the bill really was about trying to keep the state from providing public benefits to folks who weren't legal in the country. Well, the fact of the matter is, federal law already did that. And so, even though the state law, in terms of providing benefits, was already there because of the feds, it did create this crisis and this culture that of fear, particularly in the immigration community, in the immigrant community. And I still remember meetings, going to meetings throughout the state and assuring people that things weren't really any different than they ever were, and that in terms of variety care, variety providing services, you could still come, and we were not asking questions about your immigration status. One of the big funding sources at that time for our clinic was maternal and child health money, block grant money from the Oklahoma State Department of Health, and they actually threatened to cut our funding if we did not start asking people their immigration status. And I also very vividly remember the board meeting when our board discussed this issue and unanimously voted that we weren't going to do that, that we were a healthcare agency. We were not an immigration enforcement agency. And our concern was about the mothers and babies and children that we were serving. Well, about that time, also, what was going on is that I learned that there was a program that it was actually started on the Bush administration. That was an option that states could, it was called the unborn child rule. And what it was, in fact, was that states could adopt this rule, this law, if you will, that would provide prenatal care to women. In this case, it was targeted to women who weren't legal. Only prenatal care, no other kind of medical insurance or health care, but just prenatal care based on the premise that the baby, the unborn child, if you will. It turned out to be sort of a very, very interesting coalition that developed. And what happened is that Chris Steele, who many of us know today in the criminal justice area, actually was the House author of our bill provide this adopt this option. We almost got it passed. Then good old Senator Imhoff, not Senator, no, Senator Coburn from Muskogee, who happened to be a physician, actually put a stop to it. He got in touch with the leadership of the House and the governor as well, and it said, "There's no way you can do this. We've just passed Oklahoma this bill we're so proud of, that this anti-immigration bill, and we can't turn around and do this." Um, so, frankly, we were so just shocked and disappointed that it didn't make out. That bill didn't make out. What did happen, however, though, shortly after that, is I got a telephone call from Kim Henry, who was the wife of then Governor Brad Henry, who told me, "Mike, if you can get the healthcare authority to agree on this rule, this adoption of this voluntary policy, that the governor would sign an emergency rule." And so, long story being short, and I know I've been very winded here, and I apologize for that. But in fact, what did happen is that did happen. We were able to get the healthcare authority to sign that rule, and in the early 2000s, I guess around 2009, the Soon to Be Sooner program. Mike Fogarty, who happened to be the CEO of the Oklahoma Healthcare Authority at the time, actually came up with that, I think, a very clever name for that program, which in fact provided prenatal care for women based on the premise that those little babies were going to be unborn. So, however you feel about the issue and the term, we used that as an opportunity to turn that around, and we were able to provide prenatal care to thousands of women. And that's still, although that program still exists, there have been attempts to try to repeal it in the state legislature just in the last even couple of years, but it hasn't been successful so far. So we're very proud of that.
Well, I appreciate your dedication and just what you did to set the stage for overall public health care, because maternal health care is important to public health care, regardless of immigration status. And, just to echo that within the census, everybody needs to be counted, every person needs to be counted. And if we have programs like this that are serving the public at large, then yes, we definitely need to include all our community members in this count. So I appreciate you, Mike, for sharing that very, very historical, monumental legislation. So with that said, let's kick it over to Senator Munson and just make sure everyone is speaking loudly enough so that our interpreter can hear. Yeah, Senator Munson, I believe I sent some questions to you, and I just wanted to know what can you share about the importance of Medicaid? And also, I understand you've done census work. I believe you said back in 1980, right? Yeah, and so that's
1980,
huge because
before you
the
were
census only
born.
comes, yeah, yes, it only comes around every 10 years. So people with institutional knowledge of the census, like, let's learn this. After you.
Let's learn this. Thank you, Jasha. Thank you very much. And thanks, Mike, and everybody else who's here listening to what really is an important issue. We used to always say healthcare is a life or death issue in the truest sense, and it literally is. So my hat off to everyone who's engaged in this concern. I have been probably for a little longer than 40 years. When I got involved in healthcare, Medicaid was a simple program that was pretty much tied to AFDC, Aid for Dependent Children. And if you qualified for AFDC, then you qualified generally for Medicaid. And that's how you got in. The eligibility was so low, just a very small percent of the poverty rate. So a very, very small percent of Oklahoma residents actually even qualified for Medicaid. Put a big burden on our federally qualified health centers, and there were just a few of them. I think about the early 80s when we were starting some work and efforts in Oklahoma. There were maybe only three or four FQHCs across the state. And it was, people were waiting 18 months to see the dentist, 6 months to see a physician. Mike and Variety were crowded. And that was actually recognized nationally. Oklahoma had some issues, but there were people here who were engaged. So the mid 80s, we got tapped by then the Villers Foundation and an organization called the Oklahoma Healthcare Campaign, or the Oklahoma Healthcare Project was created. Mike knows that. He served as one of our early board of directors and board chair, I think even for a period of time. And I had the good pleasure of working as their first executive director. And we worked really hard with about 120 other organizations to do the first real Medicaid expansion in Oklahoma. And like Mike said, there was interest and a concern for pregnant women and children. So we really focused on that population group. And we were able to make, we thought 85% of poverty was great. We were being successful then, but there was a huge increase from the 30 and 40% of the poverty rate that many Oklahoma families were facing. And I can remember that fight at the state capitol when, and I was not a member, I was working for the advocacy organization, and I had worked for the legislature. So I had friends in the Capitol who told me after we finally agreed on a measure that one member planned to come and propose an amendment to scale back the eligibility, a fairly substantial rate. So all of us gathered at the Capitol. We were going to have this big press conference and really bust him out, as the kids say. And he got wind of that. He accosted me in the hall at the Capitol and said, "What are you doing?" And I said, "What are you doing? And didn't you propose this amendment?" And it was like, "How did you know that?" Well, I have friends in the building. So actually, he pulled the amendment, and we proceeded with the very first huge Medicaid expansion in Oklahoma. It was hard. It was hard. Actually, I finally became a member of the legislature. We proposed a single payer plan in Oklahoma in 1991. It got out of the House committee, almost passed the House floor after a 4-hour debate, and it did not pass. But as a result, I negotiated creation of a blue ribbon panel on healthcare, and it was from that panel that the Oklahoma Healthcare Authority was created and began to operate business. And Garth Splinter was the then first executive director. He was also the chair of the blue ribbon panel. And it's funny, I'll say this very quickly, because the legislation that I had an opportunity to author along with other members that created the Healthcare Authority also called for managed care. That was how we were going to save money. And it's interesting because the same proposals that the governor is making now about privatizing managed care third party is what we tried to put in place back in the early mid 1990s. And rest assured, it did not work. It did not work. It was quite expensive. The accountability was limited. So we've been there already, been there, done that. So I hope that people who hear this, who are engaged in Medicaid now, understand that people's lives truly are dependent upon it. Oklahoma still has some of the worst take-up rates, eligibility rates. And if we are going to do better about underserved populations, we have to know who they are and where they are, fill out that census, and we need to make sure that a voice is given to all of us to express our concerns and our desires to expand health coverage to everyone.
And that's perfect and so on point. Yeah, I think it pays to have this context so you don't waste time in terms of thinking about lives. Again, the visibility of those most undercounted or more marginalized communities can be reflected in the census data. So that's why it's important for those of you who are connected or come from these communities to really push that out there, especially in terms of potential legislature or legislative measures that could reduce your access, especially as Senator Munson highlighted, a proposal that's being proposed right now in 2020 that was proposed in 1993. What is that, 20 years ago? Well, I appreciate you. Thank you so much. So Carly, we just have a little bit of time left for this panel. If you could, briefly walk us through the OK policy timeline, and if there's anything to simplify Medicaid in any way, please share. Thank you.
Okay, well, that's not a tall order. Okay, so the thing that I like most about Medicaid is when we're talking about federal programs, often we get very technical, we get very wonky, we start talking about percent poverty level, and for people who don't live and breathe this on a day-to-day basis, it can just go completely over their heads. So I think it's just so much more helpful to simplify it down to Medicaid allows low-income Oklahomans to see a doctor and fill a prescription. And over the years, we've recognized that more and more Oklahomans who couldn't do either of those things needed to. And so we've expanded the program to accommodate them. We've shifted, as Mike mentioned, to accommodate the soon-to-be Sooners. And I loved hearing you talk about Mike. He's one of my favorite people. And so when Oklahoma voted to expand Medicaid, State Question 802 at the end of June, it really was sort of another sort of logical progression in how Medicaid and healthcare generally has worked in the U.S. for quite a long time. And when it comes to how Medicaid expansion now, which expanded coverage to low-income childless adults and some parents, how that will proceed is still kind of a question mark, honestly. We know that the state has to tell the federal government that they want to do it within 90 days, I believe, of the measure passing. And that's easy. That's just filling out a form. There's not too many opportunities for the state to get something wrong filling out that form. And then we know that this has to implement expansion by July of 2021. And everything else is kind of is a question mark. And so there's a couple big questions now that I think we're going to have to tackle. One is making sure that the expansion is adequately funded. We've heard the governor talk about how we can either have roads and bridges or we can have healthcare, and that's a really false equivalence. The money is there and the legislature has option, and legislators know that. Talking to Representative McIntyre the other day, he said it's going to be as big of a problem as we make it. And the legislature passed something reasonable earlier this spring. We expect them to be able to do it again. The other piece is going to make sure that it's being implemented in a way that means people can actually get the care that they are entitled to. So whether it's making sure that the state isn't trying for work reporting requirements again, making sure that people who need Medicaid can enroll and stay enrolled as long as they're eligible, or to Angela's point, making sure that the state isn't trying to relive history with another disastrous attempt into privatized managed care. I've been yelling about Medicaid expansion professionally since 2013, which feels like a long time, but then I hear Mike and Angela talk, um, and now like it's incredible. Like we finally have we've done the thing. We've done the thing I've been advocating for, and so many other people have been advocating for so long. But there is still just so much more to do, and making sure that it goes off as smoothly as possible is really where that census component comes in. For every Oklahoman that's undercounted, that's less federal money that's not coming into. That's federal money that's not coming into the state, and it's our money. It should be going to our people. But the very complicated algorithms that the feds use to determine how much money comes in are based on having an accurate head count. And it's our money. We spent so many years getting our Medicaid expansion money back to Oklahoma. And we should, I think, just expend that same effort into getting the rest of our money back too.
That's so awesome and perfect. Thank you for, simplifying. It was a tall order. I totally understand. The best way that I can simplify the census is saying you need to RSVP to that party if you want to ensure your piece of cake, right? Like if you don't tell them you're coming, there might not be enough
I'm
cake.
stealing that.
You deserve that cake. Yeah, I been doing radio interviews. They're like this long, and so you have to get in what you can get in. But yes, again, appreciate all of you on this wonderful panel. I mean, this very accomplished panel of Together Oklahoma advocates. You know, before Together Oklahoma was here, y'all were together in Oklahoma doing the thing. Yes, thank you so much for your context, your history. And so we're gonna move on. I appreciate y'all. Talk to y'all later. Um, let's bring this music up again. Yes, we are celebrating the Medicaid anniversary. Happy birthday, Medicaid. You are 55. I think that is federal age recognition for senior citizen. Go get that discounted restaurant bills and all that, as you deserve to be recognized and honored in terms of our healthcare access, which Oklahoma has been ranked in the bottom 10 for the most uninsured, underinsured across the nation. And so it is so wonderful that we did pass Medicaid expansion at the end of June. And we do have another person that we're going to pull up who can speak to kind of the actions of how that happened, but also make that connection to the census. If you didn't hear it for the first time, you know, in that panel, why it's important to not just learn about what Medicaid is, but also to celebrate it, but also the importance of the census and its connections to your healthcare, to your access for these children, for maternal health care, for elderly care, disabled care. There's so many Oklahomans that benefit from this access to health care. So I do want to just drop that we are also, hey Carolyn, we are also, gonna have some videos, but before we go to the videos, I want to put some trivia up, and if Jessica is able to, she will put this up. But for any of you who can answer this question, that's one of your, one of your, oh my goodness, you're entering yourself into the drawing for one of 3 gift cards. I am nutrient depleted right now, so I apologize. Perfect. Here we go. Thank you, Jessica. You lift me up. An undercount of just 2% could cost the state of Oklahoma how much over the next decade? And so I'm going to give you multiple choice. We have 675,000. Is it 1.8 million? Is it 650 million? Or is it 1.8 billion? Again, an undercount of 2% of our state's population could cost the state of Oklahoma, all of us Oklahomans, how much over the next decade, over the next 10 years? 675,000. Is it 1.8 million? Is it 650 million? Or is it $1.8 billion? I love Meg. We are going to show the answer now. I think if Jessica caught it. There's our multiple choice. Yeah, pick any of those. I'll go ahead and give you the answer though. It is D, 1.8 billion. That is $1.8 billion that Oklahomans would not have if even we just have a 2% undercount. That's a lot of people not to count, considering we need this funding for healthcare, for education, for the roads, for public housing, for transportation. Thank you. All right, let's move on to this first video. It's a video that our Oklahoma policy storyteller, Miguel Rios, put together for us. It is of a mother and daughter from Braggs, Oklahoma. So let's travel down to Braggs.
My name is Ginger Glory, and I am a registered nurse, but first and foremost, I am, the wife, the mother, and the grandmother of 9 grandchildren, beautiful grandchildren. Medicaid has made a difference in my family's lives. It means that we can focus on being a family, we can focus on important things together, and not have to make some of those hard decisions of, how we're going to pay a bill or what have you. But more importantly, it's peace for me to know that when I'm long gone or not able to help anymore, if it ever happens, that they do have a resource so that they can have a healthy life. They have access to health care. As a registered nurse, I can tell you it's crazy important. I don't want anyone to ever go without health care. That is I think it's a basic human need. I don't think anyone should ever be without it. Why should they have to give up health care? So that as a nurse, I'd have to say it's important because of that. Everyone deserves quality care. And they can't do that unless they have access.
My name is Heather Bridges, and I am a registered nurse. And Medicaid is important to me because everyone deserves, the best healthcare.
Absolutely.
They do have chronic conditions, stuff that they have to go every 6 months for like their heart conditions. And I think that just having that available to them and knowing that they can go and they can get preventative care and follow-up appointments and make sure that everything is still okay and we don't need to do any further treatment, that means a ton, because if something were to be bad or change in their status, then we can address that and we don't have to decide, okay, how are we going to pay for this next visit, or how is my daughter going to pay for it? Because she turns 19 in December. So that means before, she wouldn't have had Sooner Care anymore, Medicaid. But now, she went and she voted with me that day. And she voted, to yes on that state question. And it was important to her because, it means that she gets to take care of her health and she can go to college and she can focus on that and paying her basic needs, like, her bills, her electric bill, the gas in her car, and not have to worry about a cardiology appointment. And so, it just, for me, it means that they're taken care of even after I can't take care of them.
One of the reasons that we're nurses is because, it's ingrained, I think, in the fiber of who we are, that we have to think about others, that it's not just about us. It can't just be, our lives can't just be about us. It needs to be more about others. It's about serving one another. And for me, this makes a level playing field, where the haves and the have-nots before, a lot of people have gone without the opportunity to be able to go to the doctor. Maybe, I'm thinking about my son. He works a part-time job and he supports 5 people, and he cannot afford even the smallest premium for healthcare. And so, why should anyone have to decide between paying that bill or how do I feed my family or what have you? And I just think that it's important that we continue to support things like State Question 802 and other initiatives to ensure that everyone that needs it and is eligible, has the opportunity for health care access. They need that access. It's important. It's 5 people, and he cannot afford even the smallest premium for healthcare. And so, why should anyone have to decide between paying that bill or how do I feed my family or what have you? And I just think that it's important that we continue to support things like State Question 802 and other initiatives to ensure that everyone that needs it and is eligible, has the opportunity for healthcare access. They need that access. It's important.
A lot of people have it in their head, like, this is going to raise our taxes and all these things are going to become, we're paying for people who don't work or they're not trying. I think that maybe they should also know that a lot of us out there, we're working and we're trying to better ourselves. And, whenever you're always like 6 feet under, it's like hard to dig your way out of that, especially when you're dealing with certain things like healthcare. I mean, who would think that you would ever have to do without a basic checkup or, medicine for strep throat if you get sick? I mean, just basic stuff, not even the heavy stuff like a heart condition, but, they do without those things. And it's not, and when you go without those things for years and years and years, you create huge, deficits in the healthcare system because you're creating like chronic illnesses that could have been prevented. And so it ends up costing them more. Where if we would have just paid for preventative care and checkups and screenings, then we could prevent a lot of these really costly procedures and things that would cost Oklahoma way more than if we just pay for basic care.
Well, and there's also a ripple effect in that. If you can't pay your house payment, say you have a mental illness or even a physical illness, you can't pay your house payment and your bills, where do you end up? Homeless? And, so there's even a more profound effect in this where, what about those rural hospitals, those doctors' offices? I mean, seriously, I don't know very many doctors that want to turn away anyone, but there is a financial impact in this. And so do we want to keep the doors open? Yes. Do we want to help some of our rural hospitals? Yes. It's just a domino effect. If you are sick and you have a chronic illness, how are you going to take care of your family? Change starts with us, and we have a responsibility as human beings to care for one another. And change, when I'm saying change in policy, change in how we live. And, now that this is passed, I think that we should be responsible and we should be good stewards. That now that people, a lot of the uninsured that will be eligible to utilize the expansion, they need to do it. They need to get involved. They need to get involved in their own health care, make wise decisions, be good stewards. And then we need to support that, as just one another, one person to another, and value and respect one another.
I mean, I gladly will pay taxes every month and every paycheck so that other people can have,
absolutely,
healthcare. I would love to. I want everyone to go and have that opportunity. I don't want them to be faced with a hard decision and something that could have been easily prevented most of the time.
Yeah. It's so important to me to know that even the generations that I will never meet, the healthcare that my family receives today, it has a profound effect on those generations. And knowing that I may not always be here, and I need that peace of mind of knowing that my kids are going to be okay. And without being healthy, it really limits their life and their opportunities. And so it's about being healthy and doing the things that you want to do, and not having to worry about your health, and maybe going to college, focus on that. You can take your focus on to something else. But as a grandmother, it's all about those future generations and knowing that they can get the care that they need.
Yes, yes. So that's, important information from real Oklahomans, with their real experiences regarding Medicaid and urgent push to ensure that not only was 802 passed, but that Medicaid is protected. And how census is connected again is the population count drives those federal dollars into this funding for healthcare access. I believe, and I might need to be fact checked on this, but I believe the last time I looked, it's about 46% of our federal dollars that we, paid in taxes, sent to the DC, and it's being redistributed back. 46% of those federal dollars is to Medicaid. So almost half of the federal funding is towards Medicaid. So with all this said, I'm going to play our tunes again. You can hear. It's the joy that I can bring right now, with this particular topic. But yeah, happy 55th birthday, Medicaid. For those of you who are here, please tell us where you're viewing from. Share this information out. It's very important information that our public needs to know. And for every time you do this, it's an entry into a drawing for 1 of 3 gift cards. We'll announce the 3 winners at the end. I believe we're just going to go ahead and move on to Miss Paula Warlick. She is an Oklahoma grassroots manager for the American Cancer Society. I'm going to read a bit of her bio. Paula James Warlick has been with the American Cancer Society and the American Cancer Society Cancer Action Network for over 22 years and has over 30 years of experience as an educator, volunteer trainer, and grassroots manager for the state of Oklahoma. Thank you for joining us tonight, Paula. How are you doing?
Hi, I'm good. How are you?
Feeling celebratory. It's Medicaid anniversary.
It is 55 years, which is so exciting. Happy birthday, Medicaid. I've been with the American Cancer Society Cancer Action Network for approximately 22 years, which you had mentioned. And Medicaid and cancer are really important. Early detection saves lives. So if you are diagnosed with cancer at an earlier stage and you have that access to affordable health care, so Medicaid expansion is going to be a wonderful addition to not just getting the health care that people need in a timely manner, it's going to save lives. I mean, who can argue with that? But if you're diagnosed at an earlier stage, your cancer diagnosis, your prognosis is much better, and your survival rate, then equating into your quality of life, is even better. And I know that you have some videos that you're going to show that we were able to work on this year under a project called Medicaid Covers Us. It's a collaboration. It's a grant that the American Cancer Society Cancer Action Network received. And we were selected as a state to have this project. We collected stories. As a grassroots manager, I couldn't tell you how many stories. We see people every day that come to our office or call our toll-free number who are looking for a way to pay for, to have that healthcare coverage that a lot of us have, but not everyone has, usually through your job, that allow you to have access to those screenings and treatments, et cetera. So we went through and found our stories. The grant paid for us to professionally have them made. It's something that, of all the work that I've done at the American Cancer Society Cancer Action Network, or ACS-CAN, it's a little shorter and easier to say, this is probably one of the proudest achievements, having the passage of this 802 Medicaid expansion for our state. prior to working at the Cancer Society, I worked for WIC, so I was very familiar with women and children, pregnant women coming in. So I was familiar with the program from that aspect. I was able to see children up until the age that they turned 5. But the problem with Medicaid until recently in Oklahoma is that if you were a male or even a female and you turned 18, you aged out of Medicaid and you would often get lost within the healthcare system. And when you did reemerge, you weren't just a little bit sick, you were very sick typically. And that is what part of celebrating today, too, is not just the birthday of Medicaid being signed, but the passage as well. I don't know if you wanted to show the videos and then we can talk about the importance of the census after that, or I could talk some about the census as well.
No, let's just go ahead and go, on
Let's
down the
do.
road to Hobart and Altus. So we'll have Hobart and then Altus, and then yeah, we'll come back on.
Super. Thank you.
I'm Dr. Samantha Jackson. I'm a family physician in Hobart, Oklahoma. Probably around 30% of my patients have Medicaid, and probably around 10 to 15% have no insurance. One of the reasons that we have a growing population of patients without insurance is because a factory here in town closed a few years ago. Many of my patients have no way to pay, but we still do the best we can for them. They pay me what they can, when they can, but I still have to write a lot off. For them, preventative care is off the table. Mammograms, colonoscopies, routine labs are out of reach for these patients without cash or insurance. Patients without preventative care frequently have misdiagnosis, and the complications can be dire. But for my Medicaid patients, I'm pretty much able to provide everything they need. We can treat their chronic problems, we can send them to specialists, we can keep them healthy so they can lead productive lives. Our current healthcare system is broken. Anything that would allow more patients to have insurance and access to care would be a step in the right direction. Allowing more people to have access to Medicaid would help immensely.
All right, Jessica, do you want to go ahead and play Altus for us? That was Dr. Samantha Jackson in Hobart. And then we'll go ahead and see Leslie Wurst in Altus.
My name is Leslie Wurst. I'm married to Matthew Wurst. We have 7 children, 4 biological and 3 adopted. The girls have a lot of developmental issues. They see a lot of specialists, but thankfully we have Medicaid to see us through it. When I met the girls, I knew that this is what we needed to do. And I talked to Matthew and he said, just go get them. Go get our girls. And we've never looked back. Everything in our life has changed since they've come, and it's all for the better. It was the Lord that placed this on our hearts. Madison has the sweetest heart ever. She sees 9 specialists, including a pediatric development specialist, a neuropsychologist, and a genetics specialist. We give her a lot of love. Charlie is an ornery 4-year-old who wants to be just like the big kids all the time. She already sees a speech and occupational therapist twice a week. My husband and I have private insurance, but we could never afford the premiums and co-pays for the girls on our salaries. We could never do what we do for these girls without Medicaid. Medicaid is more than health insurance for our family. It provides a peace of mind and financial security. Most of all, Medicaid gives our girls the care that they need for them to thrive.
So
Well,
Music.
yeah, I was trying to pause it, but yeah, happy birthday, 55th birthday, Medicaid. And like you said, Paula, it's the impact of Medicaid. It's not just the passage and the expansion, but it's seeing these stories and who's been impacted in these ways due to Medicaid access. So, and speaking to that, you were going to mention a little bit of the connection to the census and Medicaid.
Yeah, I would be happy to. Well, the project, first of all, that before I get into the census, was a really great way to personify and collect stories to really not just talk about the issue, but to educate people about why it's so important. So, talking today about what the next step is, and the census really fits in well with the passage of 802, the importance of it. The census only comes around once every 10 years, and filling it out however you choose to. And the pandemic has created all sorts of barriers in some ways, but thank goodness for technology and for this particular webinar to let us learn more about that. So, Congress and representation comes to our state through the census. When I first started working for the Cancer Society, we actually had six congressional districts. Now we have 5, and that's based on numbers and census that are counted. So if you think about it, one, that's really important. But the representation that you have in Congress goes even further. When you have representation in Congress, they are able to represent you back home. And they're also able to continue that dialogue that shows things that are really important, like the impact of drug pricing. Protection for people with pre-existing conditions is absolutely essential. Think about it, cancer. It's a pre-existing condition. Currently, it's protected under the Affordable Care Act, but we always are hearing about that sometimes even that is not set in concrete. So having the representation and counting the numbers is actually incredibly important. But what else is important with the census is the amount of money, the amount of people that are counted within the census, and the amount of money that will be collected. That's absolutely vital to Medicaid's success. So if we're undercounted, then our state's not going to be able to receive the money that is needed. So a lot of people probably on this, I'm going to say call, webinar, conference, event, spent a lot of time collecting signatures to get this on the ballot. And they did it in such a way that they didn't just collect what was needed, they doubled that. So making sure that everybody is counted, just like every single petition was counted, is so absolutely vital in getting the money and showing not just the need because we passed this piece of legislation, but the money that is needed and the resources that are needed. An underfunded Medicaid program will not be able to provide the things that we've talked a lot about during this call and the things that are needed. And so with that, I cannot emphasize enough how much and how important it is. You went over a lot of things earlier in the call, things that I think give some people pause to fill it out. Please don't pause to fill it out. You must, because this opportunity only comes every 10 years. We need to get it right, and we need to have everybody counted. So it's absolutely crucial to what we've all been working on for years now, but in particular, since the beginning of this year. So I'd like to thank OK Policy for inviting me and the American Cancer Society Cancer Action Network to show some of our videos. And it's really important. And thanks for allowing us to speak.
Of course, it was certainly a privilege to be again in such an accomplished group of grassroots advocates working for all of us, all of our healthcare needs, healthcare access for even our most marginalized and vulnerable populations. So I appreciate all the remarks you've made, especially in pushing out the census effort. So thank you so much, Ms. Paula.
You're welcome. Thank you.
Yes. So I'm going to bring on the music again because let's celebrate. I'm just trying to see the most emphatic responses from our interpreter here. I'm just kidding. They have a job to do. So let's get on with the announcement of our trivia winners. or excuse me, our gift card winners. We have, oh my goodness, maybe Jessica can put them on the screen because I'm having a hard time reading the little type on my screen. Carolyn McElroy is one of our winners. I did see Harriet. What was that? Harriet Porter and Javi and Vicky Elizondo. Yeah, you three, if you've heard your name, Javi and Vicky Elizondo, Harriet, I'm sorry, was that Porter? Yes, and Carolyn McElroy. If you all would private message us on our Together Oklahoma Facebook page, your mailing address and your email, and then tell us, do you prefer a virtual gift card or a physical gift card? And then we'll follow up with you later. I just want to bring this program to a close. We're a little bit past our time, but I appreciate those of you who have been with us for the whole evening and watched through the panels and the videos. Again, there's so many stories in respect to those who have been positively impacted by Medicaid. I think the negative impact of just, not having healthcare access is the potential implications of, not having preventative care. So you're not able to access doctors as you need to see them for checkups. You end up in the emergency room with, usually an emergency that might not be something that can be treated in a way that would be minimal if you had access to healthcare versus something that is just right now we have to do it, it's urgent, and then you end up with a larger hospital bill. So again, myself, I am somebody who has benefited from Medicaid early in my early parenting days. Prenatally, I was a Medicaid recipient, was able to get the care that I needed during my first pregnancy. So yeah, for me, I have a personal interest. Maybe that's a disclosure, but I'm so glad that all of you turned out the vote and were able to push passage of State Question 802. Many of us in rural communities really understand that need for healthcare access, especially as many of our rural hospitals have come to a close throughout the years. We can make the change, though, even if you are unable to participate politically, as in voting, you can certainly be civically engaged by filling out your census. Again, you see this website below, my2020census.gov. Anybody, regardless of immigration status, needs to be counted. It is critically important to getting our families and communities the resources and representation we deserve. Our census numbers need to reflect the diversity of our communities and the diversity and accurate representation in terms of our elected leaders. I think that will bring us to a close. We've announced our winners, we were partying, and so with all that, we'll see you next time. Thank you for joining us.